When you need a dental implant, probably the most important things that we need to tell a patient before he gets a dental implant is that a dental implant is not a replacement of a tooth. It is a replacement of no tooth. It is for someone that has lost his natural tooth, and we replace it with an artificial titanium pin that goes into the bone, and we build an artificial tooth on top of that. Your problem with that is always that you can't feel. There's no tactile sensation on an implant. So we always try and keep some of the natural teeth in the mouth so that the patient is able to feel. The procedure of a dental implant is not a very complex procedure. We make various 3D printed molds. We plan the procedure in detail. We plan the surgery in detail. But the reality of it is there's always, in any surgical procedure, some surgical risks involved. Those surgical risks are explained to a patient, and once we go ahead with the procedure, it's a fairly simple process of getting a new tooth where you've lost your natural tooth. We do, however, need to take those patients and really up their oral hygiene, because the patient has lost his original tooth for a reason. And the fact that we're giving him an artificial tooth back does not change that patient's habits. So we need to make sure that he's going to look after the implant better than what he looked after his natural teeth, else he will lose those as well. So we get those patients back on a regular basis, and we try and keep them motivated so that we can build something that's going to last long term. Implants, however, do not age well. And in time, gravity sucks and your natural teeth will keep on moving and the implant will not. So over time, there's going to be a discrepancy in the height of the implant versus the natural tooth. And we try and prevent that by giving the patient a bite plate to wear. If the patient wears the bite plate, he stops that aging process and the implant stays nice. If, however, they do not, we expect to see them a couple of years later, 5 or 10 years later, to modify the implant crown slightly, and he then continues further with his implant journey.
Your dentist, your choice.